Welcome to the biology classes. So, in the previous class, we have studied about various topics like various contraceptive methods, isn't it? And its advantages and disadvantages we have discussed. Now, we are going to study another topic that is MTP, medical termination of pregnancy. Okay, medical termination of pregnancy, MTP, or in common term it is known as what? Abortions. Okay, so what is MTP? The intentional or voluntary termination of pregnancy before full term. Okay, means if a person is doing the termination of pregnancy voluntarily. Voluntary means by his knowledge or intentionally, if what someone is doing, that is known as what? Medical termination of pregnancy or induced abortion. Okay, so all over the world, if you take around 45 to 50 million MTPs are performed in a year. Okay, and that is around one fifth of the total number of conceived pregnancies. So, I have discussed already that whether to accept or legalize the MTP, that depends upon the government and the attitude of the what the ruling ones, isn't it? So there will be some rules in each nations. Okay, so in some countries it is not accepted due to what? Emotional, ethical, religious, social issues, etc. are means when we consider all this, some countries they are not legalized. Okay, the MTPs, thinking that what it is, something what it's just like killing, isn't it? Once the embryo is formed, it's also one person. So if it is killed, that is actually, or it is aborted, it is just like a killing. So likewise, so much emotional, ethical, religious issues are associated with it. Okay, so in many countries it is not accepted or legalized. Okay, but in India in 1971, okay, with lot of restrictions, understood, MTP is allowed. Okay, because if MTP is not controlled, what will happen? It can lead to indiscriminate illegal female feticides, isn't it? So that is in India it is very famous. People wants what? Boy child. So they, if they come to know that is, if this is a female child, what will happen? Many couples, okay, they may go for MTP. So that is what this medical sex determination, that is amniocentesis for sex determination is strictly banned. Okay, so likewise here also MTPs, if it is not legalized, what will happen? It will lead to female feticide. Understood? Feticides. Then, why, when MTPs are needed? Sometimes to get rid of the unwanted pregnancies that is happen due to an unexpected time, isn't it? Due to casual unprotected intercourse, or sometimes due to the failure of contraceptive methods used by the couples, or during rapes, isn't it? So in that cases MTPs are needed. Understood? Then other reason is what? When the mother's life is what? Harmful, or when it is under the threat. Okay, that may lead to the mother's death, or health conditions will be affected by this pregnancy. So in that cases also, only what is needed? At that time MTP is needed. So to terminate the pregnancy before what? The full term is achieved. Understood? So due to what? Unprotected sex, or what? the failure of some contraceptive methods used by the couples, or in the case of rapes, or you can say when the mother's what health, okay, are means that the pregnancy can lead to the harmful conditions of the mother. In that conditions, the MTPs are essential, okay, or done. So when to conduct MTPs? The safer time for MTP is the first trimester, means up to 12 weeks, okay, up to the first 3 months will be safe, okay. And second trimester means after this 3 months, okay, it will be difficult, okay, it will be very riskier. Then another thing is associated with MTPs. MTPs are performed by unqualified quacks. Means doctors, those who are not having qualifications, or those who are only have fake certificates and all. They are involved in the process of, or in the MTPs. Understood? So that will be dangerous for the mother, and also for the baby, no problem, but it will be dangerous for the mother also. Okay, so that is one problem associated with this unqualified quacks. Okay, they are what helping to conduct this MTPs. Another trend, okay, another dangerous thing is the misuse of amniocentesis to determine the sex of the child, and that will also lead to MTP. Understood? Female feticide. Understood? So these two things are very dangerous associated with MTPs. That is the involvement of uncertified or unqualified quacks, doctors. Okay, for money they can involve in this. And the second thing is what? Female feticide. Understood? So this kind of practices should be completely avoided, because this will be dangerous for the fetus and also the mother. Okay, then so people should be made aware of the the problems of unprotected coitus, okay, and the risk factors involved in illegal abortions. Okay, so this is only the what method to prevent the MTPs. Understood? MTPs, I told, due to what the unwanted pregnancies. To avoid this, people should be educated, okay, for what the use of various contraceptive methods. Understood? So effective counseling should be given. Then, so about MTP, it is clear now. So next topic is sexually transmitted infections, or STDs. Okay, diseases also we can say. Okay, so what is STDs or STIs? That is infections or diseases which are transmitted through sexual contact. They are known as what? STI, or venereal diseases, VD, or reproductive tract infections. All this please remember. STI, STD you would have studied. Okay, so same thing only, sexually transmitted infections here we call. Then when otherwise it is also known as what? Venereal diseases, VD, or reproductive tract infections. You have to learn this short forms, because sometimes in short forms the questions comes. Okay, so STI, then VD and RTI. Okay, all these are same only. Then examples of this are gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, okay, trichomoniasis, hepatitis B, okay, and AIDS, isn't it? HIV. Understood? So these are some of the STIs. Okay, and among this, HIV is very dangerous. We have heard, you might have heard about this. Okay, so among this, hepatitis B, HIV, etc., can be transferred by the sharing of injection needles, isn't it? Nowadays, disposable injection needles are available. Before, how it was, you might have heard the needle might have be boiled and then it will be used again. So now it is completely banned. Disposable needles only are used. Understood? The reason is this. Then surgical instruments. Okay. Then transfusion of blood. Okay. Then from mother to fetus. So all these are what the methods by which HIV, hepatitis B, etc. can be transferred or transmitted. What are they? Using sharing of injection needles, surgical instruments. Okay. Then what? Transfusion of blood or from infected mother to the fetus. And among this, various types of STIs or STDs, okay, hepatitis B, genital herpes, and HIV infections. These are not completely curable. Okay, other diseases are completely curable if they are found in the early stages and treated properly. Okay, so the early symptoms include what? Itching, fluid discharge, slight pain, swellings, etc. in the genital region. Okay, so sometimes females may not show the symptoms very early. Okay, so very less symptoms or absence of symptoms. Okay, that will lead to what? The means undetection of the disease, means the persons will not be going to the doctor and take what? Treatment, proper treatment, isn't it? Because of the social stigma. So this can lead to complications, and that may lead to even pelvic inflammatory diseases, PID. Okay, pelvic inflammatory diseases, abortions it can, if it is not treated, I am saying. Okay, stillbirths, ectopic pregnancies in the tubes. Okay, pregnancy happens means the the child, fetus will start growing in the tubes only. Okay, it will not get implanted in the uterus. Then infertility, cancer, all this can be formed if the STIs are not found and treated at the proper time. Understood? So it is very important to identify and what treat the STIs in the early stages itself. Okay, and anyone can be what get these infections, but the age group of 15 to 24 are more vulnerable. Okay, so what all we can do to avoid the what STIs? Avoid sex with non-persons or what partners or multiple partners. Then try to use the what the barrier methods, and if any doubt is there, that person should go to qualified doctor for the what early symptoms and early detection and to get it treated. Understood? So these points you have to remember because it can be asked. Okay, point wise you have to study the things. For example, like this questions can be there, and even in MCQs these points can be given and can be asked. So all the points you have to remember. Understood? Okay, so about STDs or STIs, is it clear? Okay, what are the other names of STIs? That is venereal diseases, VD, or reproductive tract infections, or RTI. Examples we have studied, and how this diseases like hepatitis B and HIV is transmitted. Then we have studied what are the symptoms, early symptoms, and what will happen if it is not treated early, and the methods to avoid this. This much we have studied. Now we are going to study another topic, that is infertility. Infertility means if a couple is not having children after in spite of unprotected sexual cohabitation. Okay, if they are not having children, that condition is known as infertility. Okay, so there can be many reasons, like physical, it can be congenital diseases, drugs, immunological or psychological, likewise different reasons it can be. Okay, so usually both the partners can have what the problems. Understood? The problems can lie with any of the partner, but even though females are blamed for this, the problem can also be with the males. Okay, so specialized healthcare units known as infertility clinics, okay, they are dealing with this kind of problems. Understood? So there are if with the what help of diagnosis and corrective treatment, then also if the couple is not able to produce children, there are, okay, some technologies, okay, or techniques which help the couple to have the children, and that is known as assisted reproductive technologies, ARTS. Okay, what is it? Assisted reproductive technologies. So among this, different types are there. They include what? In vitro fertilization. In vitro means what? In the artificial condition. Okay, vivo means in the natural conditions. Okay, anywhere if it is used, vivo means natural and vitro means in the artificial. Okay, so in vitro fertilization means here the what the fertilization is taking place outside the body of the female. Understood? And it will be followed, means after the formation of the zygote or embryo, that will be transferred to the female. Understood? So among this, one method is test tube baby, you might have heard. Okay, so in this, ova from the wife or a donor can be collected, and sperms from the husband or a donor. Understood? That will be collected, and then it will be induced to form the zygote under simulated conditions. Means the conditions which are similar in the female's body. Okay. Then if the zygote, okay, or early embryos with blastomeres up to 8, okay, then we have to transfer it to the fallopian tube, and that is known as zygote intrafallopian transfer. Okay, and if embryos are more than 8 blastomeres, then it should be transferred into the uterus, and that is known as intrauterine transfer. Understood? Then so this difference between SIFT and IUT is what? In SIFT, how it is done? Zygote with blastomeres less than 8 or up to 8, you can say. Okay, if it is transferred into the fallopian tube, then it is known as SIFT. And if the embryo is more than 8 blastomeres, then we have to transfer to the uterus, and then it is known as intrauterine transfer. Understood? So the embryos formed by in vivo fertilization means what? The embryo formed means in the natural conditions, that is inside the female's body, also can be used for this purposes. Okay, another technique is gift. Okay, that is transfer of ovum collected from a donor into the fallopian tube. Okay, so when it is needed, when a female is not able to produce the egg, but having all the suitable environment for fertilization and for the development of the baby, means their uterus and other what environment for fertilization is okay, but she is not able to produce the fertile ovum, then what we can do, for the ovum can be collected from a donor, and then it can be introduced into the fallopian tube. Understood? So this is known as gamete intrafallopian transfer or gift. Okay, so gift, SIFT, etc. Nicely you have to understand what is all this. Okay, then so in this condition, what? In gift, the female is not able to produce the fertile egg, but they are having the suitable environment for fertilization and further development. Then another is what? Intracytoplasmic sperm injection. Okay, intracytoplasmic sperm injection, ICSI. Okay, so this is also a procedure to form an embryo in the laboratory, in which sperm will be directly injected into the sperm ovum. Sorry. Okay, so the sperm will be collected and it will be directly injected to the ovum. That is known as what? Intracytoplasmic sperm injection. Okay, so in when it will be used in cases of what? Inability of the male partner to inseminate. Okay, the if the male partner is not able to inseminate the semen, okay, or deposit the semen into the female's tract, then or due to very low sperm counts, means what? Number of sperm, if it is very less, in that cases we can use another technique, that is AI, artificial insemination. Understood? So in this, the semen will be collected, and then means it can be from the husband or from a donor. Okay, and then it will be artificially introduced into the vagina or into the uterus. Okay, so if it is into the uterus, then it is known as intrauterine insemination. Understood? So AI means what? Artificial insemination. Understood? It can be either deposited to the vagina or to the uterus. If it is to the uterus, it is known as IUI, intrauterine insemination. Okay, so all these techniques, whatever we have studied, so what all we have studied, what all this techniques used to get the children for the infertile couple is altogether we known as means altogether is known as assisted reproductive technologies. What is it? Assisted reproductive technology. So what all we have learned in that? In vitro fertilization, isn't it? Then and embryo transfer. Okay, so this is the common method, and we have studied that in test tube baby program what happens, isn't it? Then we have studied gift. Okay, intracytoplasmic sperm injection, artificial insemination, intrauterine insemination. All these techniques, they help the couples, those who are having not having children, to have the children. But the problem is what? It is very costly. Okay, so all the people cannot afford it, and also there are what factors like emotional, religious, social factors also involved in this. So parents or couples can also adopt children, isn't it? There are many children what who are orphaned, okay, or destitute children. So these couples can even adopt the children, so that means legally, isn't it? So that is also help the couple, those who are not having children, to have children, isn't it? So in India there are strict laws, so that option also is there. So this chapter is very clear to you all. I hope read it very thoroughly. Okay, thank you.